Wishing you all a very good morning. Let me share with you today, in a nutshell, some basic facts about breast cancer as we understand it today. Science keeps evolving, and every decade or so, our thought process about a particular facet of it does keep changing, growing, getting deeper and deeper. So I've been practicing in, let's say, cancer treatment, cancer surgery for the last more than 30 years. And I've been watching it evolve, grow, change. The first, from 80s to 90s, we were doing bigger and bigger surgeries for breast cancer, trying to conquer it. Then from 90s to 2000, our focus was to limit the surgery to breast conservation. And we did realize that conservation is as reliable, breast conservation, removing just the tumor and of course the lymph nodes, and preserving the breast, coupled with radiation and chemo. It had almost the same survival, same cure rates as the bigger and bigger surgeries of removing the entire breast. And in fact, sometimes back we used to even remove the chest wall, trying to fight this disease. Well, then 2000 onwards, our greater focus was on evolving chemotherapies, better and better chemotherapy. And presently we realize that breast cancer is not one disease. It has two facets. One is stage, and one what type of breast cancer it is. I mean, there are some markers, we call it signatures, tumor signatures. They divide breast cancer into various types of breast cancer. And one is stage. What stage the patient comes to us with. Stage 1, 2, 3, I often share with my patients, it should not be called cancer because it is curable. So why give such a sinister name to it? Well, but stage 1 is the tumor where it's only in the tumor. Stage 2 is when it's gone to the nodes. And stage 3 is when the nodes have become heavily laden with cancer cells. I mean, more than, let's say, 10 nodes or more than 3 nodes, they make it kind of stage 3. It's called, or the tumor has become so large that it's involved, it's burst out of the skin. So these are stage 1, 2, and 3. And stage 4 is where it has gone to the rest of the body. And it's only the stage 4 where we don't promise a cure, and we try and keep the disease under control. Well, so this is one aspect of breast cancer. That's what stage it is that you come to us. If you keep delaying treatment, of course, the stage keeps increasing. And then what type of breast cancer it is. Those tumor signatures are, often used words are, which I'm sharing so that you also understand. ER, BR, HER2, Ki67, and grading. All these things put together tell us what kind of breast cancer it is. Is it the aggressive variety, or is it the innocuous, the more harmless variety? Well, so according to the combination of stage and this type of cancer, we decide what all treatments do you need. 3 treatments are there for any cancer: surgery, chemotherapy, and radiotherapy. And so these 3 things are not necessary in all. But when they are necessary in all, then also we have to sequence them. Surgery first or chemo first, and radiation in which cases, and which cases you can avoid it. Now, these days, the focus also is on, there are certain very good types of breast cancer. In early breast cancer, that means early stage types of breast cancer, very good breast cancer, we can avoid chemotherapy. And surely we can save the breast in most patients when they want it. A patient should want, or the attendants, the family wants, that we should preserve the breast. We can practically preserve in every patient, practically every patient. In the sense that we will remove the tumor, preserve the breast, and then shape it up. The shaping it up is called oncoplasty. So where is it where we may not give chemo? It's early stage. ERPR positive, HER2 negative, we can do another test called genome testing. When we genome testing report comes and it says chemo is not required, we can even avoid giving chemotherapy. So this is for consumption of one and all. This is what is the understanding of breast cancer in the present day in 2024. Science keeps evolving, as I said, keeps changing. Maybe 10 years later our thinking would be different, but well, this is what we practice these days. Thank you for listening to me. Hare Krishna. Vaheguru.